This lesson is on ophthalmic medication administration. Why are we giving our patients ophthalmic medication? We can do this for many different indications. If our patient has dry eyes, then we need to make sure that our patient has moisture in their eyes, so they need lubrication. If our patient has an infection, then we need to treat that infection with some kind of antibiotic. Now, if our patient just has inflammation, then we're going to instill steroids to reduce that inflammation. If our patient needs to have an ocular assessment and we need to dilate, then we're going to give medication to dilate that pupil. Let's watch a video on how nurses install ophthalmic medication, and watch very closely, guys. Pop quiz at the end of the film.
Topical ophthalmic medications can be either eye drops or ointments. Eye drops will flow easily into the conjunctival sac, whereas ointments require placement of the ointment along the lower eyelid. For both eye drops and eye ointment administration, place the client in a supine or sitting position with their chin lifted. With the non-dominant hand, place a cotton ball or tissue just below the client's eyelid and gently press downward to expose the conjunctival sac. Have the client look up toward the ceiling. Hold the medication in the dominant hand and rest the side of the hand on the client's forehead about 1 to 2 centimeters above the conjunctival sac. Administer prescribed drops. If administering drops that have systemic effects, apply gentle pressure to the client's nasolacrimal duct for 30 to 60 seconds to allow for proper absorption. For eye ointment application, expose the client's conjunctival sac in the same manners used with eye drops. Apply a ribbon of ointment to the inner edge of lower eyelid on conjunctiva, working from the inner eye to the outer eye. Once instilled, have the client close their eyes and rub the lid lightly in circular motion with a cotton ball, if not contraindicated.
What are nursing interventions surrounding installing ophthalmic medications? I need to observe my patient's eyes prior to administering medications. If they have some kind of goop in their eyes, some kind of drainage, I need to wipe that out with a warm washcloth. I also need to make sure that I complete hand hygiene before and after administration. Now, if I'm going to give 2 different kinds of medications, drops or ointment, I need to make sure that I'm installing the drops first, so I'm not washing away the ointment, and I need to wait 5 minutes between those 2 medications. I want to make sure I hold that dropper about a ½ inch above the eye. I want to prevent injury to that patient's tissue and make sure that I'm not contaminating the end of my medication vial. I also want to review that administration technique with my client because they're going to have to do this when they go home. Okay, guys, I know I told you about that pop quiz. I hope you watched that video really carefully. When you are doing NCLEX ordered response questions, you're going to have a list of options just like this, maybe 1 through 7, maybe 1 through 4, but you have to use every single option and you have to get them in the right order to get the most points available. So let's go over this one more time. 1, I'm going to make sure that I'm wiping my patient's eye from the inside to the outside. I'm going to make sure I'm pulling that lower eyelid down while I'm asking them to look up. And then I'm going to instill the medication in that lower conjunctival sac. Once that medication is instilled, I'm going to have my patient gently close their eyes, don't rub, and they can look left and right, up and down to get that medication moved around. If I'm going to instill a medication that involves systemic absorption, like timolol, then I want to make sure I'm including that lacrimal duct, that tear duct on the inside of the eye, minimum 30 to 60 seconds. Great job, you guys. I know you can do this. All you have to do is keep practicing.